For the VO2 max, like measuring the maximal amount of oxygen that you're taking in during, I guess, maximal exercise, you mentioned to me, most people are very interested in that, and they're not going to get that measured directly. They're not going to a lab like yours or to their, physician doing it. But they want to know, should I do it? Or is there a estimator I can do that's good enough? Or how do I decide if I should or shouldn't? Like what, like athletes, probably, maybe they should. But, so this online calculator, the World Fitness Level you mentioned, maybe you could talk just briefly about the science behind that and
Sure.
how people can decide.
So I'm not associated with this at all, but World Fitness Calculator it's a valid calculator for estimating VO2 max. And so what I mean by that is it's based largely on a lot of research that's been conducted in Norway, in particular Norwegian Technological University. They've been real pioneers in a lot of interval training research. And so the bottom line is they have a lot of data on measuring things and seeing how they correlate or are related to or can predict VO2 max. And so of all of the calculators that are out there, I think this is the one that people could trust the most in terms of answering a few questions about their age, their sex, their typical activity levels, and it will give them a reasonable estimate of their VO2 max. But it's still just an estimate because it's saying you're that typical 40-year-old. It's not going to be able to dial in any better individually, but at least it's going to give you a marker in the sand, a reasonable marker. And even if it's not precisely accurate, you can rest assured that it's going to allow you to track changes over time. So you plug your answers into the online calculator, it spits out a value and says your VO2 max is 38 or 45. And then you engage in some sort of training program for 3 or 6 months, and then you do it again. And if you see a directional change up or down, hopefully up, you can be reasonably confident that your training program has been effective at increasing your VO2 max, even if the precise number is not 100% accurate.
Yeah, that makes sense. There's a few factors in there that were a little more on the personalized level, like your resting heart rate and your max heart rate and BMI and waist to hip ratio or waist circumference, I think it was. So there are definitely some features aside from your age and everything like that, but also the estimation of like how intense are you going with your exercise? There's a subjective component to it where I was like, oh, I go hard, like so. Again, it's kind of good to know that you can use that online calculator. People are interested in probably doing that. But for the average person, do you think measuring it directly is really...
The other way is, and in between, if you will, is there's submaximal exercise tests. And there's a number of validated tests that are out there. We could drop those in the show notes, but where you basically are performing a couple of levels of submaximal exercise, measuring your heart rate, and then essentially plugging it into an equation that's going to extrapolate and said, okay, well, if this is your rate of increase in heart rate, once you get up to your maximum, this is what your VO2 max value would be. Or there's, I don't know if you have these here, but the shuttle run test or a beep test, where basically you're running back and forth between a set measured distance. And after a point, you're not able to keep up. But it's called a shuttle run test or a beep test. And it basically, the more power you're able to exert, or the more that you can keep up with as you have to get faster and faster to run between these two markers, that also correlates with your VO2 max. So bottom line is all of these are submaximal exercise tests. They're better than just an online questionnaire, even that validated one that I mentioned, because at least it's providing some data about you. So you can't just say, oh, I'm engaging in vigorous activity. It's going to actually measure your heart rate a little bit. So that would sort of be an in-between. But yeah, the gold standard is having a VO2 max done in an accredited laboratory. And that's going to give you your VO2 max value directly. And it's also going to give you a lot of data on your power outputs, your heart rate, even your lactate, in order to try and look at training zones, for example.